Welcome to this discussion on transforming the treatment of aortic stenosis with a novel biomimetic valve. I am Nicolas Van Mieghem from Rotterdam. I'm joined by Ole de Bakker from Rigshospitalet in Denmark. And we're going to discuss the DurAVR valve, transcatheter heart valve, the early experience, but also the randomized controlled paradigm trial. Ole, thank you for joining. Can you elaborate a little bit on the paradigm trial? What is it, and is it a one of its kind? Is it a new kind of trial?
Yeah, so the paradigm trial is a prospective randomized trial, which is the pivotal trial for the DurAVR transcatheter heart valve to get also finally then FDA approval. And it is a head-to-head comparison. So it's one-to-one randomized DurAVR versus commercially available TAVR devices, SAPIEN Evolut, one-to-one randomized. There are two unique aspects to it, I think, or maybe even three. First, it's for the first time where they include all comers, so all risk. High, intermediate, low risk, so an all-comers population. That's unique. They're going to have a cohort of 1,050 patients, roughly, yes, one-to-one randomized. And after that, there's a continuation of 450 patients extra, additional patients, only in the low-risk cohort, yes. So that's one unique aspect. On the other hand, they also have a valve-in-valve single-arm component, not randomized, of course. And then the other unique aspect on this trial is that for the first time, this has sub-studies, not only with CT, as we know from previous studies too, but they have also CMR sub-studies in this paradigm trial. So there's a couple of unique aspects on this paradigm.
And definitely in sync with contemporary guidelines that highlight also the importance of CMR and also the transition to lower risk patients.
Yeah, exactly. So Nicolas, you are also involved in the paradigm trial. So how will we ensure really quick enrollment in this trial?
Well, it's important, right? Study enrollment is very relevant, and we're talking about 1,000 patients. We are recruiting patients in 80 sites in the US and in Europe. So that is quite a large number. Even Canada is also involved. And the first patient you already enrolled in October of this year. So I think now it's all about creating momentum, and I think we are ready to get that momentum. Also important is that it is already IDE approved by the FDA in October. So also US sites will become eligible for participating in this study. And this commercial approval of the DurAVR across all risk levels, that is also an incentive, I think, for sites to participate. And I think from a patient perspective, I mean, the concept of this biomimetic valve with potentially superior hemodynamic valve performance, that should be intriguing in terms of a lifetime management and durability.
Yeah, it's also my experience, at least from having recruited the first patients. If you present the study, typically they're very favorable of going into the study indeed.
So talking about these first cases that you did in Copenhagen, what are the unique features that you see during the procedure?
What I appreciate on it is that it combines kind of the ease of use of a balloon expandable device, which it is. So it's really predictable, it's easy, it's safe, it's just the predictability is super high. Also low pacemaker risk, etc. that comes with the balloon expandable, and it combines then also the features of the great hemodynamics that we know from typically self-expanding devices. So it's it takes the best of both worlds, and that's what you get with DurAVR. So in that way, I love the device. It's great. You can offer your patient really something additional, I would say.
Yeah. So it's coupling precision to performance,
yes.
Self-performance. Yeah.
And then now this is about the procedural optimizations, but what do you believe on the longer term this paradigm trial then will add to the whole field of TAVR? Is there some additional things to expect, or could it lift the TAVR whole field to a high level?
I definitely think so. So this is obviously a balloon expandable valve. We're all familiar with the concept of balloon expandable valve. So that is not a novelty. The novelty is the biomimetic aspect of it. And this should translate in superior hemodynamic performance. And as a matter of fact, in the early experience, you also did a couple of cases in small valves. the performance of this valve was quite impressive and really resembling what we could have with the best in class that we commercially have available today. So I think that is very a very strong early signal, if you will. And I think we will focus more and more on hemodynamic valve performance, flow patterns. So we are talking a lot about laminar flow versus turbulent flow. These are things that are worth mentioning and also worth further investigation. And I think that is also where the CMR study comes into play. I do believe that we are filling some knowledge gaps here with this trial.
I think so. I mean, I think also it brings us to look further than just alleviating that aortic stenosis. I think we've been thinking too simplistic about this disease. And a patient with severe aortic stenosis, just alleviate the aortic stenosis and all is good. No, I think we have to look further. We want optimally that there's good aortic flow, there's also retrograde, there's optimal LV remodeling. I think we have to look further than just taking that stenosis away and say, now you're cured. No, we have to lift this treatment of that disease to a higher level. And I think this is a device in our hands that could bring us this perspective to our patients.
We're no longer in the early stages of TAVI, right? This is the next step, and in 2026 this should become this is a therapy now that definitely is a gold standard and also heavily endorsed in contemporary guidelines. Thank you very much, Olaf, for this overview of the PARADIGM trial and also this discussion on this new biomimetic balloon expandable valve. Thank you for your attention.